Assalamu alaikum. Today we are going to start a series of lecture on female genital tract, pathology of female genital tract. First of all, we will discuss vulva. Vulva is the external part of the female genital tract and it is composed of two parts. There is labia majora and labia minora. Labia majora is hairy skin that is present outside, whereas labia minora is the mucosa. Let's illustrate this. This is a simple diagram showing labia majora and labia minora. Labia majora is the outer hairy part and that is skin in nature, whereas labia minora is the inner mucosa. Now we will get started with the pathology, and first of all we will discuss a condition that is known as vulvitis. Vulvitis is the inflammation of vulva vulvitis. Vulvitis is inflammation, or we can also say reactive inflammation of vulva. So first of all, let's discuss the course of vulvitis. First of all, there is a primary insult. There is a primary insult, and this primary insult leads to chronic pruritus. And due to this chronic pruritus or itching, the female scratches her vulva, and this scratching leads to secondary condition. Initially there was a primary insult, and due to which there was chronic pruritus or itching, and this chronic pruritus and itching resulted in a scratching of the vulva, and that leads to secondary condition. Now on the base of this primary insult, the vulvitis is divided into three types. What are three various types of primary insult? An insult can be an irritant, it can be an allergen, or it can be an infection. These three insults can be there. So on the basis of these three different kinds of insults, the vulvitis is divided into three types. Irritant, allergen, and infection. An irritant will lead to chronic irritant dermatitis, whereas an allergen will cause chronic irritant, chronic allergen dermatitis. And we'll study the infection later on. An irritant will lead to chronic irritant dermatitis, whereas an allergen will cause a chronic allergen dermatitis. Now, how will it present? What will be the manifestation of these insults? Vulvitis, whether it is having an irritant etiology or it's having an allergen etiology, it will have same clinical presentation. Clinically, it will be erythematous. That is, the vulva will be red. Clinically, it will be erythematous, weeping, crusting papules, and plaques. Whether the vulvitis is having an irritant etiology or it is having an allergen etiology, it will have a same clinical picture. That is, the vulva will be red, it will be weeping, it will have crusting papules, it will have swelling and plaques. Now, what are the irritants and what are the allergens? Irritants are the chemicals present in various soaps, detergents, other chemicals, whereas allergens are chemical components of deodorants, perfumes, powders to which a person is allergic, or some chemical preparations that are used in clothing industry. What are the irritants? Irritants can be some chemicals present in the soap, detergents, other chemicals. What are allergens? Allergens are chemical components of deodorants, various perfumes, certain powders, and some chemical preparations of clothing. So till now, we discussed that vulvitis is of three types: infectious, irritant, and allergic. And an allergen will lead to chronic allergic dermatitis, whereas an irritant will lead to chronic irritant dermatitis. And what are the irritants? Irritants are certain soaps, detergents, and chemicals, whereas allergens are chemical components of deodorants, perfumes, powders, and certain chemical preparations of clothing. How will a person manifest? A person will manifest as a red erythematous vulva, it will be weeping, it will have crusting papules and plaques. Now, infections. Our third type was infections. So, it's very easy to know, as you all people already know, that infections are caused by various infectious organisms. Top of the list will be HPV, human papillomavirus. It can also be caused by HSV type 1 and 2, herpes simplex virus. It can also be caused, and these infections are mostly sexually transmitted diseases. The infections of vulva are mostly sexually transmitted diseases, and they can be caused by viruses such as human papillomavirus, and herpes simplex virus type 1 and 2. It can also be caused by certain bacteria like Neisseria gonorrhoeae. It can also be caused by certain fungi like Candida. So this was our infectious etiology. We discussed the three types of vulvitis.
Vulvitis, irritant, allergic, and infectious.
Irritant, allergic, and infectious. Now, these three various types of vulvitis will cause a very important condition. We have now understand the basics, and now we are going to study a very important condition. Let's say this is the vestibule of a female, and this vestibule, she is having chronic vulvitis. Her vulva is inflamed and she is chronically scratching her vulva. So it will lead to inflammation. And as you people know, whenever there is inflammation, there is a lot of exudates. There is a lot of exudate coming to that area. Now, there will be a lot of exudate coming to this vulva. Now, reminding you your anatomy, we are having some glands, and these glands are known as Bartholin's glands. And these glands produce mucousy secretions normally. So, if there is chronic inflammation, this inflammation will cause this duct of the Bartholin gland to obstruct, and this chronic inflammation will obstruct and block this duct of Bartholin gland. And as this duct will be blocked, the Bartholin gland will increase in size.
Enlarges.
The Bartholin gland is going to enlarge, and this condition is known as Bartholin's cyst. This condition is known as Bartholin's cyst, and it is a complication of
Vulvitis.
It is a complication of vulvitis. Bartholin's cyst will present as, clinically on examination, it will present as swollen, unilateral, and excess pain. It will be swollen and on the lower vestibule, because as this cyst will be present on the lower vestibule, so the lower vestibule will be swollen, and one side of one Bartholin gland will be affected at one time, so it will be unilateral and there will be excessive or severe pain. Now we are going to study some other non-neoplastic conditions.